Hi everyone. In today's clip, I will talk a little bit about hormone replacement therapy or HRT. Just a reminder that anything I post here is not meant to diagnose or cure anything and it's for informational use only. For any health-related matters, please consult your healthcare provider. Hormone replacement therapy is the act of reintroducing hormones the body has reduced or lost, mainly basically estrogen, progesterone, or sometimes testosterone. This method is primarily used for menopause, perimenopause, hormonal deficiencies, including andropause, and gender-affirming care. So its core function is simple: restore signaling molecules that regulate temperature, mood, bone, metabolism, and reproduction. So basically, it is used for symptom relief, such as hot flashes, night sweats, vaginal dryness, sleep disturbances, and mood stability, or instability, I should say. So estrogen is considered the most effective treatment for menopausal symptoms in conventional medicine. Doctors will prescribe this to menopausal women also for structural protection, meaning to prevent bone loss and reduce osteoporosis risk. In postmenopausal conditions also, I have seen it being prescribed for improving skin elasticity, cardiovascular protection, cognitive preservation, and longevity. Now, side effects and risks include, for short term, we have breast tenderness, headaches, mood swings, nausea, and bloating. For long-term, serious risks include blood clots, especially oral forms, stroke, coronary artery disease, breast cancer, higher with combined estrogen and progesterone, and endometrial cancer. So medical news today recently had mentioned that the risks depend on age, timing, dose, and delivery method, and they have recommended transdermal or patch or gel for fewer clot risks. On the orthomolecular side of things, or medicine side of things, we treat hormones as a part of biochemical terrain, not with isolated drugs. The core philosophy is that restore optimal internal chemistry using natural molecules at physiological levels. So bioidentical hormones are used in combination with vitamin B complex, D, E, minerals like magnesium and zinc, and essential fatty acids. I need to explain that bioidentical hormones are chemically identical to the hormones our body actually naturally produces. Traditional HRT hormones may be synthetic or animal-derived and are not identical in molecular structure to human hormones. But in general, there is no one treatment fits all, and each individual may respond to a different method. In alternative and traditional approaches to HRT, herbal phytoestrogens or plant mimics are used, such as black cohosh, red clover, soy isoflavones, and flaxseed or more, which produce mild estrogen-like activity. In traditional Chinese medicine, or TCM, menopause is seen as kidney yin deficiency and liver imbalance. And the normal treatment is through acupuncture, herbal formulas, and there is actually small pills that they call Liu Wei Di Huang Wan. I hope I'm pronouncing it right. And the aim is to restore energetic balance, not replace hormones. Now, my very favorite is, of course, Avicenna, who also is known as Ibn Sina, who lived back in 980 to 1037 and was a Persian medical guru and is considered one of the most influential physicians in the history that I very much refer to. And his book is called Canon of Medicine, which is 5 volumes. This one is right here. This is actually volume 2 that I'm holding right here, and it's quite thick, as you can see, with immense amount of knowledge and wisdom. To be honest, calling Avicenna a doctor is like calling a cathedral just a building. So Avicenna's perspective on menopause is that it is a shift in temperament towards coldness and dryness, and he suggests restoring internal heat, moisture, and vitality, and his style of interventions include oil, which is central therapy, which includes sesame oil, almond oil, and rose oil. These are used for vaginal dryness, nervous system calming, and reproductive organ nourishment. On the vaginal dryness topic, there is also marshmallow root and cucumber seed added to these oils and infused with, which is quite effective. Then number 2 is warming and moistening herbs like fenugreek, fennel, anise, and dill. The effects are supporting digestion, which is key to hormone balance, and to enhance reproductive vitality. Number 3 is the uterine tonics such as marshmallow root and licorice in moderation. And of course, do not use licorice if you suffer from any high or low blood pressure issues. Then there's lifestyle prescriptions such as warm baths, gentle movement, emotional balance, and sexual health maintenance. Then core principle explaining that the hormonal symptoms arise from weak digestion, leading to poor humoral balance, leading to organ weakness. So the treatment path is digestive strength, leading to improved blood quality, leading to organ nourishment, leading to symptom resolution. So Avicenna's remedies are less like swallowing a pill and more like tending to a garden. Oils are not just applied, herbs are not just ingested. They are directed, like sending warmth, moisture, or strength exactly where the body has grown brittle or depleted. So how you use something matters a whole lot more or as much as what you use it for. So oils are considered liquid architecture for the body, and their external application is very important. Oils are absorbed intelligence. So we can use them for abdominal massage, and the oils used for this would be things like sesame oil, which is warming and penetrating, sweet almond oil, which is moistening and softening, rose oil, which is cooling and calming. And we will need to actually slightly warm the oil and massage lower abdomen in circular motion or clockwise for about 10 to 15 minutes, 10 to 20 minutes, daily or several times a week. This is to improve blood flow to reproductive organs and reduce dryness, tension, and stagnation. Herbs are considered internal sculptors. By simmering sort of 1 teaspoon in water for 10 to 15 minutes and drinking them while they're warm, they will improve digestion, reduce bloating, and support hormonal balance via gut function. So the herbs can also be powdered and mixed with honey, like ground fennel and honey, ground fenugreek and honey, and take a teaspoon daily to build strength and enhance reproductive vitality. Infused oils bridge between internal and external. For example, rose petals infused in oil or fenugreek infused in sesame oil, and this is used for massaging. Sitz bath, which is underused but very powerful for pelvic and reproductive tissues. In this, we use warm water plus herbal infusion like rose, chamomile, or fennel, and sit for 10 to 15 minutes. This directly affects uterus and pelvic circulation. A classic combination for menopause type dryness used externally is a combination of almond oil plus sesame oil, 70 to 30, 70 almond, 30 sesame oil, and add a few drops of rose oil, massage abdomen, and it can be applied vaginally. By the way, rose oil is not rose essential oil, it's rose infused oil. And internally, use fennel tea daily and small amounts of fenugreek powder with honey. Oils are often used at night because when we sleep, we enter the restorative phase, and herbs are often used after meals because they provide digestive support. Now, temperature matters, and most oils, are to be used warm, not cold. Cold sort of worsens the dry cold condition. So think of these approaches as different languages describing the same storm. Of course, all alternative systems sort of offer slower, systemic, and often safer modulation, and they're going to take time. They're not like chemicals, quick acting. So the real divide is sort of philosophical. HRT says replace what is missing. Traditional system says restore the system so nothing is missing. Hope this has been helpful. My clips are also available on TikTok, Rumble, and YouTube. Like and follow for more. Be the light.